We begin tonight with Idaho health leaders saying they are starting to prepare for the Omicron variant, but they add there's still much we don't know about it. The Idaho Department of Health and Welfare held its weekly briefing today to discuss what they do and what they don't know in tracking the variant. Our Tristan Lewis joins us now with the latest on COVID-19 in the state and what leaders are urging. Tristan?
Mark, some positive news did come from today's briefing. Director Dave Jepson says the state has seen a decline in hospitalization and positivity percent. And as you know, crisis standards of care had been lifted last week in a majority of the state. The Panhandle, who is still in crisis standards of care, is also starting to see some improvements. But as things trend upward, leaders ask everyone to take precautions, especially as we wait Omicron's arrival in the state. As health leaders worldwide continue to work to understand more about the Omicron variant.
More unknown about this virus right now, this variant, than we have known.
We know less about this than we know about this new variant.
Medical experts in the Gem State do know one thing. Because of the strain sequence, they can tell once the new variant has officially reached Idaho.
One of the things that's peculiar about the Omicron variant is that it's much like the Alpha variant that we saw last spring, in that there is a unique PCR profile for certain tests that may give us a sneak peek that it's here.
Dr. Christopher Ball, the chief of Idaho Bureau of Laboratories, says the Bureau is in communication with Idaho Clinical Labs to watch for this particular PCR profile. If a lab is able, they are asked to switch to tests that can identify this certain variant for the next few weeks.
I feel confident that with the program that we have in place, that when the variant gets here, we should be able to detect it.
To be able to do variant detection, Ball urges those who get a COVID test to opt for molecular testing.
Even though we're trending in the right direction, testing is still very important.
As more studies and research are done over the next 2 weeks, including how transmissible the variant is and how it interacts with the vaccines, Idaho's top health officials continue to echo what's been said for months.
We do urge Idahoans to use this opportunity to get vaccinated, even if the efficacy is less than it has been against Delta. This right now remains one of our best protections against these variants in general.
And during today's meeting, the FDA approved the treatment of COVID-19 antiviral pill from Merck today. It's useful in high-risk adults with mild to moderate COVID-19 symptoms. Dr. Christine Hahn says before the pills can be described to Idahoans, the FDA will need to issue a full authorization. And once the pill has been approved by the FDA, the federal government will have a say on how much Idaho gets. And Dr. Hahn says, from what she's been told, it might not be a lot in the beginning.
Yep, it seems like it will be a slow rollout. All right, Tristan, thank you.